As some people argue about the significance of COVID, I want you, my audience, to be well informed and well prepared, and critically to know what you can do. What I'm focusing on today is an interesting article that was published in Pakistan in the Nation, and their NIH, their National Institute of Health, denied a surge in COVID cases as experts note a seasonal rise in respiratory illnesses. Now, this is Pakistan, and they are trying to downplay the sharp rise of COVID cases in Pakistan. But what had happened is that one of their professors, Professor Saeed Khan, an infectious disease expert, stated that 25 to 30% of patients presenting with cold and cough symptoms have tested positive for COVID 19. This is very important. And what it's demonstrating is two things. One, this is a global phenomenon. And two, everybody seems to be downplaying it. And I think they're downplaying it because fundamentally they acknowledge that if this is true, especially circulating in regions that have had lots of elephants, it represents a failure of stopping transmission. And they don't want to acknowledge that. So they would rather to let people get sick. Well, I think by now everybody is recognizing that you're in this on your own. Nobody seems to be helping you. Nobody's advising you. They're just letting you get sick. So you have to be prepared as to how to protect yourself and your loved ones. And I'm saying this from the personal experience of having friends and family having to go into hospital because they're unwell. This is serious stuff. So, what is going on first, and what can we do? So, let's start with the basics. And now you have to know that one of the things I'm going to be highlighting is around nitric oxide. And you will find in the description the link to the course, and there is also a free ebook. If you don't want to do the course, you at least get the information for free if you sign up. So, I'm looking for solutions that can help you. So let's start with a few basic things. Another thing on Twitter this time, or X, caught my attention. I was looking specifically at the comparison of COVID cases and wastewater concentration on the 3rd of January and in San Jose. This is in the USA. And this is from COVID Caution. And he's concerned about the fact that the green area represents the 7-day average of COVID cases, and the red area represents the 7-day average of COVID wastewater concentration. You'll notice that up to here, this was in January of 2022, that's just when Omicron cracked, you can see there's a close correlation between cases and wastewater. As well, similarly, in the early part of the pandemic, that's when they were actually testing. But from about April of 2022, the interest in testing fell off. And you see that although the peaks tend to mirror each other, there's a significant gap between the two. What that tells us is that the only reason that we don't know about the cases is because we're not measuring them. And the wastewater peaking is likely to be a more accurate prediction as to what is happening in the community. And you can see here, this was in 2022, and that peak was maybe about 3,700, 3,800, the case count, 7-day average. In 2023, January, it was about 3,400, and at the moment, it's about 3,200. It seems that there is a falling off, but we may see a further spike in January of 2025. And this is indicative of the fact that we are likely to be having problems. This is, January of 2024. And so when we look at this pattern, we then ask, well, what is happening now in 2025? Where are we in terms of the numbers? An important point to try and reflect on. So I've gone back to the data from Santa Clara region in the USA. Luckily, some people are still sharing the data. And this is where you can find it if you want to go and look at it yourself. County of Santa Clara. This is information on COVID. And they have here the breakdown looking at the respiratory virus dashboard. So this is very, very useful in terms of understanding what is going on. And when you look in more detail here, this is then showing you the wastewater and the disease comparisons between COVID, flu A, flu B, and RSV. And you can see here that in the past few months, all of these have been rising, but it appears that COVID is actually quite stable. But that's 365 days. If you change this to 30 days, you can see actually that COVID is starting to rise and flu seems and RSV seem to be falling off. So this is the trend as to where we are now. Even more concerning is when we look at their emergency department and they compare the different respiratory viruses here. What we can see when you look at this 365 date, you can see down in November of 2024, you then start to see it rising going into December, Christmas period, January, it's staying up. Now, what is rising is actually the combination. The black line is flu, COVID, and RSV. The orange line here is just flu. And you can see down here that COVID on its own is pretty low. Flu on its own, RSV on its own is low. But when you look at the comparison of all three together, the COVID, flu, and RSV, that is going up and rising. This is a very, very telling sign because what we're seeing here is what we call viral co-infections. And when we look back, and sometimes you have to go back to try and understand the relevance of viral co-infections always occurred. And what it means is that you are infected with more than one virus at the same time. There's a reason it's not common, and it's largely because if you are infected with one virus, you tend to produce an interferon response. And that interferon response blocks all viruses. So it's not common for people to have multiple viral infections at the same time. And as you saw on that graph, COVID, flu, and RSV, triple infections are occurring at the same time. This is what it looked like in the past. And this was from 2020. In July 2020, when they were looking at community acquired viral respiratory infections among hospitalized patients in Singapore, the critical thing to take away from here is that the co-infection rate between SARS-CoV-2 and other respiratory viruses was low at about 1.4%. That's significant. When we go back to the chart, it's all the way up at 7.7%. And this is not just COVID and flu. This is COVID, flu, and RSV, all three together. So the co-infections are not that common, but they are occurring much more commonly now. This is the bit that people are not getting their head around. They keep on thinking that COVID on its own, because the symptoms are mild, it's not anything to worry about. Again, let's look at the data. It's very important to understand these things. And I am showing you here a really important paper looking at the persistence of spike protein in the skull and meninges, brain axis, contributing to sequelae of COVID-19. There's a video in this that I need to show you for you to understand just how significant this is in the context of what is going on. And so just before I get that video, I'll show you quickly a simple point. Whenever you're thinking of COVID, COVID is no big deal if it doesn't get in your bloodstream. Everything is about your mucosal immunity. And this is why I'm talking about this. So this is what your immune system is looking like. You can see here, this is a virus. It infects your upper airways. It then replicates, it spreads, it can go down into the lungs. But if you have good mucosal immunity, where it picks up the virus quickly, kills the cells that are infected, the virus can't penetrate this mucosal barrier and therefore get into the bloodstream. I keep on telling people it's not whether or not somebody had a little bit of a sniffle, it's whether or not they've had persistent symptoms with virus getting into the systemic circulation, because it will still do significant damage. But your mucosal immune system is very sophisticated to keep it out. But once it breaks through the mucosal barrier, and that's the bit now that you have to get to, this is now what I want to show you, is that once spike protein gets through the mucosal barrier, this here is what it will look like. And this is a mouse model, but it's likely to be the same in humans. And so this is the video as to what happens when they put spike protein in. Wherever it's lit up is a representation of spike protein. So this is all through the lungs going into the brain. And initially it was the kidneys. Look at this. This is the kidneys. It's going all the way through there, just different sections of this mouse to show you where spike protein goes once it breaks through that mucosal barrier. This is kidneys. It spreads to causing significant inflammation, spreads to the liver, not as highly, but certainly gets there. It spreads into the intestines as well. And as usual, it's spreading into the lungs. The lung, but interestingly, you notice that the lung is not the highest area that's affected. It's mainly the kidneys. And as it will go up here, this is showing you the spread into the spinal cord, spread going up into the brain. This is pretty significant. Once virus breaks through, this is what happens, where spike protein gets everywhere, into the skull, into the meninges, into the brain, into the substance. Pretty serious stuff. And so this is why I'm saying to people, your job is to try and prevent this virus from getting into your bloodstream. It's as simple as that. Don't worry about anything else. And how patients usually present is usually very subtle symptoms. Look out for fatigue. Look out for any change in, you may have a headache or any other symptoms that are persistent. That is a transient change after you've had upper respiratory symptoms. And sometimes the upper respiratory symptoms can be really mild. And so people tend to forget it and not assume how significant it is. So, what can you do? And this is where now I am trying to find answers myself, because I need to protect other people. So I know what I do, and I was asked this question when I was interviewed recently by Steve Kirsch. What do I do? What is my strategy for protecting myself? And this is where the nitric oxide comes in really important. A lot of people never heard about it, and they just think that it doesn't make any sense. But just follow me. This is science. And if you understand the science, it helps to protect you. The first thing is that nitric oxide is a gas, and it's produced in all cells, and it's very important in the bloodstream. It diffuses out, and it has a very short half-life, meaning that it's destroyed very quickly by enzymes, and so it has its effect quickly. And remember, nitric oxide is what works in angina, so that when we use a GTN spray, it's interfering with nitric oxide to increase the capacity, and it causes blood vessels to dilate. So it does a whole lot of functions in the body. As we said, the vascular homeostasis, it works in the brain. It reduces platelet activation with clotting, inflammation, wound healing, oxidative stress, sexual function. This is a remarkable molecule. And once you understand that it tends to be stored in your sinuses, okay, this is a frontal sinus, this here is a maxillary sinus, this sphenoid sinus sitting right under the pituitary gland in the brain. This is a really important gas and molecule for your body. And most critically, why am I talking about it in relation to COVID? Because there is one function of it that is remarkable. It is antiviral. So it has antiviral and antibacterial properties, and all these things impacting on aggregation, vasodilation. All of these impacts are done by nitric oxide. How do you help to increase your nitric oxide? You don't need to take any special supplements. You just need to hum, low hum. If you are part of a choir and you're singing all the time, it's going to be increased. It's a remarkable system. When I said that, when you look at most religions, the fact that they do continuous humming and chanting, I am convinced it's because of the nitric oxide, the health benefits of it, especially in the sinuses. And this is really important for people who have sinus issues. If you have sinus issues, please just hum as frequently as you can remember. A good example is a cat. Apparently, cats purr for a very similar reason. And you'll notice cats just purr all the time when they're resting. They just increase their nitric oxide levels. I don't know why it's so important for cats. That's a different issue. But it is very simple to do, and everybody can do it. And so, because of that, I have created a link for where you can get it from. As I said, this is nitric oxide and COVID. This is a whole course at a discounted rate. If you don't want to do the course, you can just read the introduction. These are all the chapters that are there. But critically, the nitric oxide ebook you can get also for free. Sign up, get it for free. Please consider doing the course. It's a great way to support our research as well. But it's about you then getting a strategy that will be beneficial for you that you can pass on to others. In that, I mean, we wrote a whole book on this, Humming Heroes, and it was done in a children's format simply because we realized that if you get the story to register to people, that could make a difference. The reality, as I go back to the data, is this is what it's showing in emergency departments. Triple, this is COVID, flu, and RSV is at the top. This is what is happening across these regions. And at the moment, what is happening is that they don't have an answer. People are not getting vaccinated because they no longer believe that it helps or that it works, because it doesn't seem to matter if they're vaccinated if they get COVID. How do you convince them then to do that? That's a whole big issue on its own. And so people are now left with absolutely nothing. They're just left to walk into this fire of raging COVID all over the place. Many people are asymptomatic but still spreading it. What do you do? That's the question. How can you protect yourself? And believe me, the answer is not to ignore it. Because as I said, when you look at the data, when you see what happens when this spike protein breaks through your mucosal immunity, I think that it's worthwhile almost playing it again just so that you understand this. This is what it looks like when the spike protein breaks through. It goes all the way through into, this is spreading into the lungs. It spreads along. I'm just jumping through into the brain. This is it here, looking from different angles. The spike protein just goes everywhere in the body, and this is how serious it is. You don't want to let your body be exposed to this on multiple occasions. That's what it's doing in the intestine, spreading all the way through the whole body and doing damage at the same time, just causing inflammatory changes. And it's important to note Omicron has a predilection for the heart. And so this is why you will see many patients now having heart related issues. It's very different from influenza or RSV. They tend to remain in the lungs. COVID-19 doesn't. Really serious times ahead of us. Protect yourself. At least take the basics of the science. Use it. What does it hurt you to hum? It's free. You can do it all the time, and you can hum your favorite songs at the same time as protecting yourself from all the circulating viruses that are around. And remember this, it's not just COVID you have to be afraid of, because many people now, especially those who have had the elephant, can't control the COVID infection. It increases their risk of other viral and bacterial infections. It means that you are exposed not just to COVID, but to influenza, but to RSV, as well as mycoplasma and streptococcus. it just goes on and on and on. You've got to find a way to protect yourself. I'm giving you a simple strategy. Please use it. Let's see if we can protect you over the next few months and years. Have a great evening.